The mRNA Technology Hub has been in the making for 2 years. The project was started during the COVID-19 pandemic when the need for Africa to build its own vaccine capabilities became evident. mRNA was used in Pfizer-BioNTech, one of many vaccines which helped stem the pandemic.
WHO believes that the mRNA technology transfer program holds huge promise, not just for increasing access to vaccines against COVID-19, but for other diseases, including HIV, tuberculosis, as well as other diseases affecting lower and middle-income countries for which there are either no vaccines or the vaccines are insufficient.
The continent was forced to rely on conventional treatment methods, masks and social distancing to protect against COVID-19, as developed countries snapped up available vaccines. A candidate manufactured in South Africa will soon be trialled.
This transfer of technology for us to can be able to produce our own vaccines, one firstly against COVID and also possibly other vaccines, will help us to be self-sufficient, because what we envisage is that COVID will remain an endemic infection, and especially for those at high risk.
We are not only doing it for South Africa, it's also going to assist the whole of the African continent and hopefully also benefit the rest of the developing world. And this directly actually comes out of our experiences with COVID-19, that some of the developed countries were hoarding their own vaccines and we were unable to get them.
South Africa is one of 6 African countries receiving technology, a move towards strengthening the continent's health security.
This is a key step for the sustainability of this mRNA technology in the continent and elsewhere. We need to make sure the capacity we are building in terms of know-how, equipment, staff is maintained through manufacturing of routine vaccines, and the routine vaccines need to be the ones that are most needed in this continent.
In time, the Afrigen Hub will be a production facility for other vaccines addressing many of humanity's most pressing health challenges, including HIV and tuberculosis. Africa currently produces just 1% of its vaccines, but the dream of manufacturing mRNA vaccines on the continent has become a reality, and the WHO and Afrigen are confident Africa will not be left behind when it comes to vaccine equity. Julie Shara, CGTN, Cape Town, South Africa.